On November 7, 2019, renowned physician Dr. Alan Shackleford addressed an Alabama Legislative Committee hearing and testified in favor of Alabama's Compassionate Care Act. In the six-part series entitled Conversations with Dr. Shackleford, you will see that testimony.
Our next speaker is Dr. Shackleford. I know that you're going to want us to come down there to watch, so if the committee will move down there.
Good morning. I'm Alan Shackleford. I'm a physician. It's wonderful to be in Alabama. I approached this really with great skepticism. I was practicing occupational medicine in 2009. Patients were coming to me and requesting that I authorize cannabis primarily for pain because we didn't do a good job of treating it. And I was very skeptical. So I went to the medical literature, and as I've said, I researched this, and I began to authorize it for a few people, but reluctantly and with trepidation. And I was actually incredibly relieved to find that it was actually helpful for these people. One of my first patients was able to stop her, well, first to reduce and then eventually stop the opiate pain medicines that she was taking. And that was astonishing. And I began to see increasing numbers of patients. And one of them is this little girl. Her name is Charlotte. Her mother called me on a February morning in 2012 begging me to see her. Grand mal seizures. She has Dravet syndrome. She had 300 of these a week. She died twice, 2 cardiac arrests. Her mother resuscitated her once at home. Charlotte, when her mother told me about the cardiac arrest, I said, okay, I'll see her. I can't promise anything, but I have an obligation as a physician to do my best and use all the tools at my disposal to care for my patients to the best of my ability. That's what doctors do, right? So I saw this little girl. We gave her, and I had done some research on this, a high CBD cannabis extract. She had 5 of those in my office. 5 of those seizures. Actually, 1 in the parking lot, 2 in the waiting room, and 3 while I was examining her in the space of 2 hours. Now, I found that Dravet syndrome is rare. It's a mutation, causes many different types of seizures, and it progresses. And status epilepticus, which is uninterrupted seizing for sometimes hours with significant brain damage, can result from this ongoing seizure activity. They're treatment resistant. The normal drugs you use don't work. She had 17, and the next drug they were going to give was a horse tranquilizer from Europe because nothing had worked. Now, the mortality is elevated, 10% by age 6, 20% by age 20, and they have sudden unexpected death in many instances. Some authors have said 73% of kids with Dravet syndrome whose seizures are uncontrolled will die. That's a huge mortality. Now, the first time, this is recorded now, it's a manuscript in Paris. Cannabis was used to treat seizures in 1464. Now, that's interesting. There was a study done in 1980, and I had read this study, use of cannabidiol to treat epilepsy. And they gave it to people whose seizures weren't well controlled. This is what happened. First dose, no seizures. They stopped. And she didn't have a seizure for a week. She's laughing. She's playing a puzzle. As she was dancing, she says, ballerina, ballerina. 300 seizures a week to 1 or 2 a month. Now, that's a cannabis extract. That's as good as Epidiolex is. It's all CBD. This was about 5% THC. That's important. There are studies in Saskatchewan that substantiate this. It's called the CARE-E study, and it is worth reading. Now, I went to Israel because I read a statement by Professor Raphael Mechoulam. Now, Rafi Mechoulam is the one who discovered the structure of THC and synthesized CBD and took the CBD to South America, which they were using in that study in Brazil. And he says research is highly respected, and the police don't interfere, and the Ministry of Health supports it. So I went to Israel, and I met him in 2013. I wanted to do research on this important, I thought, advance in treating epilepsy. Now, Rafi and I are friends. This was in the Israel Institute of Sciences. And we're still in touch. That's last month in Jerusalem.
Now that Dr. Shackleford has explained how his medical research and treatment of patients with medical cannabis changed him from skeptic to a proponent of medical cannabis, he will address the impact that legalized cannabis has on America's opiate problem in the second edition of Conversations with Dr. Shackleford.